losses are maintaining. But no, continuously every day, no. You don't know what chemicals they are.
Pure. Chopra, and I will be your MC today. I request one of the district executive members, district secretary, to kindly call it the chairman. I request the chairman, Dr. Manisha Kaushik, to kindly honor the association president, Mrs. Sunita Jain. One minute. You can just keep it here. I request District Chairman Dr. Manisha Kaushik to call the meeting to order. The meeting is called to order. Thank you. I request Subcommittee Co-Chairpersons, Mrs. Anshu Jain and Mrs. Arvind Sahai, to come and recite the inner prayer.
हाँ जी हम सब ही हैं तेरे बालक भूले ना ये इतना कर दो धर्म और संस्कृति भेदभाव हमें नहीं स्थान रहे सभी मानवों की सेवा का हमें सदा ही ध्यान रहे आवश्यकता हमें मदद की हो सकती है याद रहे सेवा करने की जरूरतें जहाँ कहीं भी आन पड़े सेवा करने को सब जन की तत्पर हम सब डटे रहें इधर वीर की शान बढ़ाए ये वर हमें प्रदान करो मानव जीवन व्यर्थ न जाए प्रभु ये प्रदान करो।
Friends, lighting a lamp before a ceremony spreads divine grace. I request our district chairman to escort our chief guest and association president, Mrs. Sunita Jain, for the lighting of the lamp. I request subcommittee co-chairperson, Usha Jain, to assist in the ceremony. I also request the doctors here to kindly join us. Past international president, after the kindly join us for the lighting of the lamp.
लाइट में बताओ ना भैया अभी ना फ्रंट में मत आना ठीक है अब फ्रंट पे नहीं आना
So kindly join us for the lighting of the lamp. Om Diko Jyoti Param Brahma Diko Jyoti Janardana Diko Alpu Me Papam Rata Deep Namostute Shubham Karotu Kalyanam Arogyam Sukha Sampadam Mam Buddhi Prakashascha Dikjyoti Namostute. Palaki Ganesh Vandana. Om Gajananam Bhut Ganyadi Sevitam Kapit Jambu Palcharu Bhakshanam Umasutam Shok Vinashkarikam Namami Vigneshwar Padu Pankajam. The lamp also shows everyone who is present how to dispel darkness. After all, fire is one of the 5 elements that forms our body. The flame of a lamp always burns upward. Similarly, we should acquire such knowledge as to take us towards higher ideals. A single lamp can light hundreds more, just as a man of knowledge can give it to many more. The brilliance of the light, friends, does not diminish despite its repeated use to light many more lamps. Thank you, Michelle, for your assistance.
मैम एक बार देखेंगे सामने सारे सारे किधर देखेंगे मैम एक बारी
Nisha Jain to kindly welcome her. Sorry, Nisha Bhargav to kindly welcome her. Now we welcome our chief guest and association president, Mr. Covrege, Dr. Manisha, kindly welcome her.
वो थोड़ी देर ऑफ करवा दो, फोटो में इतनी घेर आ रही है.
स्वाति में प्रोजेक्ट बंद करवा दो दीदी
Ladies, kindly give her a big hand. We are lucky to have her here on this today. I request Anita Jain ji to welcome our keynote speaker, Dr. Sarita Shyam Sundar. Usha ji, kindly welcome Dr. Sonal Basla, Head of Ops and Gynae. Ladies, kindly give them a big hand. I also take this opportunity to welcome other doctors and dignitaries. Dr. Shweta Balani is here. Dr. Shweta Balani. Welcome her. Dr. Atul Agarwal, Payal Agarwal, who are helping us with vaccination. Dr. Anju Bala. I take this opportunity to welcome members of Innerview District 301 Executive Committee. We have a District Secretary. Kindly acknowledge her presence. We have District ESO. Kindly give them a big hand. Vice Chairman Deepika Bali is with us. Kindly give her a big hand. District Secretary Deepak Goyal is here with us. Past International President Abuji is here. Neeta ji being a national editor and also part of the health committee, so I thought I'll welcome her with the health committee, but she is digitally herself, we welcome her. Past district president, past district chairman, Purnima ji I see, Veena ji I see, we welcome you all. Seema ji, a big welcome. Okay, Ruchika is walked in I think, and Ruchika ji, we welcome you. And I also welcome all the presidents of various clubs and all the other inner wheel members who have come today from far and long. I also welcome my health committee co-chairpersons. They are here and helping in every meeting. मैं अकेला ही चला था जाने दे मंजिल मगर लोग साथ आते गए और कारवां बनता गया। कितना पुराना है ये शेर, लेकिन आज भी हर मौके पे हम इनर व्हील में स्पेशली इसकी अहमियत देखते हैं। प्रोजेक्ट समर्पण was conceptualized by our district chairman Dr. Manisha Kaushik, a subject which is very close to our heart, but a project of this magnitude was not possible for a single club. Under her able leadership, we were able to garner support from 43 clubs to come forward and do this project. Yes, all the presidents and members deserve a big applause. I now request Subcommittee Chairperson Mrs. Nisha Bhargav to tell us a little detail about the project Samarpan. Nisha ji.
Thank you, Vinita. Respected District Chairman Dr. Manisha, Association President Sunita Jain, Association Secretary Miss District Executive Members, eminent speakers, past International Inner Wheel President Abha Gupta ji, our galaxy of PDCs, esteemed guests and fellow Inner Wheel members. Good morning to all of you. Today, we take a significant step forward in our mission to create a healthier, more compassionate world. I am honored to introduce our Mega Joint District Project, a pioneering initiative that aims to eradicate cervical cancer in our community. As we align with the third area of our international and association presidents for this year, we reaffirm our commitment to empowering women and promoting health for all. Let us work together to make a difference and create a cervical cancer-free future for generations to come. Today, we are donating thermocoagulator, which is a life-changing treatment for cervical cancer. Thank you. Especially in rural areas with limited access to advanced medical facilities. In villages, thermocoagulation can increase early detection and treatment, reduce cervical cancer mortality rates, empower women with accessible health care. Training local healthcare workers and awareness champions can maximize impact. Heartfelt gratitude to Sudarshan Foundation for their generous donation of 2 Philips oxygen concentrators worth ₹1,20,000. Your kindness will breathe life into the lives of countless needy individuals. Your philanthropic spirit is a shining example of compassion and humanity. We are deeply thankful for your trust in our organization and for supporting our mission to provide quality healthcare to those in need. May your foundation continue to spread love, kindness, and hope to many more lives. Today we proudly celebrate a milestone in our unwavering commitment to protecting the health and well-being of our community's young girls. Since 2013, our organization has been steadfast in its mission to provide cervical vaccination drives, empowering countless girls with the gift of health and a brighter future. And today, we take immense pride in vaccinating 138 more girls as part of our mega project. This achievement is a testament to our organization's dedication, members' hearty contribution, and passion for creating positive change. Cost for 138 girls, 2 doses each. Cost will be ₹3,50,600. आज ये इतना बड़ा मेगा प्रोजेक्ट है, मैं आपको एक और अपने यंग जनरेशन से मिलवाना चाहती हूँ। अब मिलवाना चाहूँगी हमारी जुनूनी और मेहनती यंग गर्ल अनिका भार्गव माथुर, जिसकी जिंदादिली और जोश से हम सभी प्रेरित होंगे और आज के मेगा प्रोजेक्ट को एक नया आयाम मिलेगा। Let me introduce her, a passionate advocate for abused and abandoned girls. During her work with NGOs and the Delhi government's Women and Child Department, she identified a critical challenge: the heightened risk of cervical cancer among abused girls due to limited healthcare awareness and access. To tackle this, Anika envisions a nationwide initiative in partnership with the Inner Wheel organization targeting cervical cancer prevention in rural India. Her plan begins with deploying 5 thermocoagulation machines in high-need areas, providing immediate treatment and care by ये अपना इसको पैन इंडिया प्रोजेक्ट बनाना चाहती हैं और इनर व्हील ऑर्गेनाइजेशन से कोलैबोरेशन करके। तो आज हमारे बीच एक्सपर्ट हैं और मैं उनसे रिक्वेस्ट करूंगी, और वो भी अनिका भार्गव भी हमारे बीच है, तो मैं रिक्वेस्ट करूंगी कि आप उनको जो भी आपकी एडवाइस हो वो आप दीजिए, जिससे हम इस अपने मेगा प्रोजेक्ट को और नया आयाम दे सकें। थैंक यू सो मच।
What a brilliant effort by a young girl. She really needs to be applauded. Then before I go on to the next subject, I apologize for not taking the district editor's name for the welcome. I welcome Hardeep Saigalji. And I also want to apologize on behalf of PDC Geeta Goyal, who is also the committee chairperson. She is unable to come today. She sent her apologies along with many other PDCs. So we have with us Dr. Sarita Shamsundar, who will enlighten us with a talk on cervical cancer and what we can do to prevent it. But before that, I would like to invite subcommittee co-chairperson Mrs. Sunita Das, and please come on the dais and kindly introduce our learned speaker.
A very good day to each and everyone present here today. Our members on the dais, the distinguished galaxies, members present, our association chairman, Madam President, and each and everyone who's been a part of this. All these collaborative efforts cannot be possible with the jury, the assistance, and loads of wishes from all of us. So could I have the privilege of introducing our esteemed Dr. Sarita Shamsundar. She's MD, FICOG, and FRC. She is the professor and unit head, Gynae Oncology, Wortman Medical College and Subdivision Hospital, New Delhi. A board member of International Federation of Colposcopy and Cervical Pathology. Organized Asia's first FCPC World Congress of Colposcopy and Cervical Cancer Pathology from 1st to 5th July 2021. She is the chairperson of Oncology Committee of Association of Obstetrics and Gynae of Delhi from 2023 to 2025. She is the immediate past president of Indian Society of Colposcopy and Cervical Pathology from 2018 to 2021. Dr. Sarita is also the member of Technical Expert Group of Cervical Cancer Screening Programs of Government of MP, Punjab, a Master Trainer, MP State Government Cervical Screening Program. She is the Academic Coordinator of Dr. N.V. Gynecology Program at Sadhurjan Hospital. Dr. Sarita is also the editor of Journal of Coloscopy and Lower Genital Tract Pathology. For her profound and significant achievements, she's been awarded as RCOG, New Zealand Award of Academic Excellence, Aptic Orator by Asia Association of Medical Women of India. She's also authored 2 books. For her significant work in her field, she's added many chapters, articles in national and international journals. So can we have a big round of applause for Dr. Sarita?
Good morning everyone. Thank you so much for the kind introduction. And it's a pleasure to be here at Parmanand Hospital. I've been here so many times with Dr. Sonal, Dr. Shripal, Dr. Nirmala Agarwal. We have done so many activities here together. And it's really nice that the Rotary Innerweed district and with all the office bearers, the senior members of the Rotary Innerweed, Mrs. Dr. Manisha Kaushik, Mrs. Anita Jain, Sunita Jain, Dr. Sunil Batla, and the past President Abhaji, the Vice Chair Dr. Ms. Deepika Bali, Deepa Goyal, Ms. Usha Jain, Ms. Anshu Jain, Ms. Aruna Thai, and all the senior members and all the members of this Innerweed district. So it's such a nice initiative by all of you for this cause of cervical cancer, which kills so many women every year in our country. आगे कैसे कोई ये गमले थोड़े से साइड से So this is the cancer profile of our country.
Please stop it. Stop. Don't
So this is the global cancer observation, and in female the second commonest cancer is the cervical cancer. And every year, around 1 lakh, about 1.25 lakh women are diagnosed with cervical cancer every year, and more than half of them actually die because of the disease. So what is the cervix and where is the cervix situated? The cervix is situated in the pelvis and it's the lowermost part of the uterus. So this is the uterus where the baby is born, and that's where you get your periods every month, and the mouth of the uterus is the cervix. So this is where it is, low down in the pelvis. So this is the cervix. This is where the cervix is situated. So this is the mouth of the uterus. So why is cervical cancer important? It is the second commonest cancer in women living in low and middle income countries. If you look at the numbers, so the number it's about 18 per 1 lakh women are diagnosed with cervical cancer every year. So it's actually 1 in 8 women. Actually the number of deaths, if you see, 1 woman dies every 8 minutes because of cervical cancer in our country. So if you look at the figures worldwide, Asia has the largest number of cervical cancers in the world, and in Asia, although China has more numbers than India, but the number of women dying because of cervical cancer in India is much more than China. So more than half of the women with cervical cancer who are diagnosed are actually dying because of the disease. So this is more than 80% of cervical cancer deaths all over the world occur in low and middle income countries where there is poor access to prevention, screening and treatment that contributes to 90% of the deaths. So if you look at the high income countries, the overall survival, the women after diagnosis of cervical cancer, more than 70% of them live but here only 20% of them are living even after diagnosis. Because they all come in such advanced stages where we really can't, cure is not possible. So the WHO gave a call for elimination of cervical cancer. So that was in way back in 2018, where the WHO Director General Dr. Tedros gave a call that this is cervical cancer is one cancer where we have everything available. We have a vaccine, we have simple methods to detect it and also for treatment. So it can be eliminated. And actually about now it's about 200 countries have actually joined it and agreed to eliminate cervical cancer from their countries. So how does cervical cancer develop? So it's basically because of a virus, that is the human papilloma virus. So जैसे like we had the COVID virus, so COVID is because of the virus. So similarly, HPV infection, this HPV is because of a virus and it enters the body at the time of the sexual contact. That's when the virus enters, and a lot of women clear the infection on their own. But if the infection persists, that can lead to precancerous lesions and then cancer. So the infection enters the body at around 15 years of age, then when the girl becomes sexually active, and then but cancer develops much later. That is because it takes so much time for the virus to cause changes in the cells. So what is this call for cervical cancer elimination? So that is the call it's a world without cervical cancer by 2030. So that means right now we are at 18 for 1 lakh women. We should go to lesser 4 for 1 lakh women by 2030. So that is possible by vaccination. 90% of the girls less than 15 years should be fully vaccinated. Screening of at least 70% of women at 35 and 45 years of age with a good test, a good screening test. And treatment of once you detect precancerous lesions, 90% of the precancerous lesions should be treated. So on 17 November 2020, the WHO launched a global strategy in how to actually do this, how to actually eliminate cervical cancer, which is what we celebrate every year. So that is the anniversary of the Cervical Cancer Elimination Day. So every year on 17th of November, it is an aggressive call for elimination of cervical cancer to accelerate this movement. So the first of the prong is the HPV vaccination. जो आप कर रहे हैं आज, but that is such a noble cause that you are all dedicated to. So the HPV Honorable Finance Minister also announced that there will be a budget especially for this vaccine. So what is this virus? So HPV virus is the most commonly transmitted viral infection, and a lot of women actually get this infection, and a lot of viral types have been identified. But the common, the high risk, the types which cause cervical cancer are these 16, 18, 31, 33, 45, 52 and 58. So it's not just cervical cancer, it can also cause vaginal cancer, anal cancer, that is the cancer from the back passage, that is where the stools come from. It can also cause vulvar cancer. So and not only that, it can cause cancer in the males also, penile cancer, oropharyngeal cancer. So all these cancers can be caused because of HPV. Now what is this? How are these HPV related? How does one transmit them? How does the infection go from one person to the other? One is the sexual contact, which is the most common route, and fomites or non-sexual contact. So it can be just touch. So just even if there is no actually penetrative sex, just a touch can also in the sexual areas can cause, and mother-to-child transmission also, that is rare. So HPV, so it's a lot of women all over the world get this HPV infection, and 95% of cervical cancers are because of this HPV virus. So it's not just that the girls the ladies who have multiple partners, of course in them it is more common, but even if they have one partner also, they can still have HPV infection. So the risk increases with the number of sexual partners that the lady has, and having sex with a partner who has multiple partners also increases the risk. So 75 to 80% will acquire at least one HPV infection before the age of 50. So most of the HPV infection, now when you get the flu, you have running nose, you have fever. But this HPV infection causes no symptoms. You will not know when you have HPV infection. It is totally asymptomatic. And also when that HPV infection causes changes in the cervix, also you will not know. Because at pre-cancerous stage, there are no symptoms, there is nothing, no, now you will not know. That is why screening is important, that is why prevention is important. So the greatest protection is vaccination before the lady becomes sexually active, because you can prevent the entry of the virus into the body. So the HPV vaccination is the first prong of the 90-70-90 and it's the first line of defense against HPV infection. So the vaccine is recommended by many organizations across the world, including the WHO, the CDC USA, the American College of Obstetrics, the Obstetrics Association of India, the Indian Academy of Pediatrics, and the National Technical Advisory Group on Vaccination, which is a government body which tells advises on all the vaccines which should be given. So how does this vaccine help? So the vaccine, these little things are the virus entering the body. So when the virus enters into the cell, into the cervix, and then it enters into the nucleus of the cervix, and then so what does the vaccine do? So the vaccine are these blue and green, these little antibodies, and that is the antibody that is going to cover the virus and is going to prevent the entry of the virus into the body. So that's how the vaccine works. So when should you vaccinate? Less than 9 years the data is lacking, but between 15 to 25 years the studies have shown 100% efficacy. After 25 years, 25 to 45 years, it is immunogenic, but it's not 100%. So what are the vaccines which are currently available? We have the 4 vaccine against, so quadrivalent means it's against 4 HPV types, 6, 11, 16, 18, because it's 16, 18 are the commonest types of HPV virus that cause cervical cancer. So that is why this is even if it is against 16, 6, 11, 16, it will still work very well. And the 9-valent vaccine is against 9 virus types. And the Covrege vaccine, this is the indigenous vaccine made in our country by the Serum Institute of India, Pune. And what are the doses? Now, below 15 years, it's 2 doses, and above 15 it is 3 doses. But there is a lot of evidence, and the WHO is now recommending between 9 to 20 years, single dose, and between 20 to 45 years, 2 doses. This is for Gardasil 4 because it has been there since many years, about 20 years since the vaccine has been there, and there are many studies which are showing that even single dose causes good antibody levels and it is very effective. But those who are immunosuppressed, then we need to give 3 doses because the immunity is low. So the WHO now recommends 1 or 2 dose schedule between 9 to 14 years and even after 20 years, and after 20 years, 20 to 45 years it is 2 doses with the Gardasil 4. But the other vaccines you have to give 3. So Covrege, this is the vaccine which is the Indian vaccine which is being used by your vaccination program. So between 9 to 14 years it is 3 doses, between 15 to 26 years it is 3 doses, and women with HIV it is 3 doses. So it can be given in boys also. So both Covrege and Gardasil 9 can be given in boys. So how effective is it? How good is the HPV vaccination? It can reduce the survival, all these cancers and HPV pre-cancerous lesions in 80 to 90%. And they are also very safe. You may ask me, is it safe? So it's very, very safe. It's been in use for more than 20 years all over the world. Many countries, 200 plus countries are actually have introduced this the vaccine into their program. And even the 9-valent vaccine is also very safe. And it has shown long-term efficacy and immunogenicity. And countries like Australia and UK, where the vaccination has been going on since many years, they have seen that these precancerous lesions and cervical cancers are significantly less, very, very less. And this is maybe, this is the girls who have actually received the vaccine, so they are, they don't find any precancerous lesions or cancer at all. And not only there, it's also in countries in Europe that have introduced the vaccine since 20 years, so that this effect is being seen. And this vaccine is safe. It is being a lot of doses, millions of doses have been given all over the world. And the common side effects are just redness, pain, swelling, and a little bit of fever they may have. Now, if you look at in Finland also, you find that the precancerous lesions are significantly less in the vaccinated group rather than the unvaccinated, and also if you see the number of who are vaccinated, there are zero cancers in the vaccinated group compared to the unvaccinated group. So coming to screenings, as I said, a lot of women get HPV infection and clear it like the common cold. So this HPV virus enters into the epithelium of the cervix and then it stays there for a few years. So a lot of women clear this virus on their own. But if the HPV infection stays for 10 to 30 years, that's when it can cause precancerous lesions and cancer. So the WHO has given guidelines on how to carry out the screening. So suppose a lady is already sexually active, what is to be done? So the screening is indicated from 30 to 50 years. And if those women with HIV, it starts at a younger age, and 5 to 10 yearly. And the screening test that is recommended by the WHO is the HPV test because it's a very good test. It can pick up very well the HPV virus. But if that is not available, one can go for a VI test, that is a visual inspection, or a Pap test. So this Pap test has been there since many years. So the HPV testing has a high negative predictive value. So if it is negative, that means all is well for the next 5 years. So the screening methods, as I said, this Pap smear is there since many years. So between 25 to 65 years, it is done every 3 years. So it's important is just not just once in a lifetime, it has to be done regularly. Whereas VI, that is, we apply acetic acid or silica on the cervix and just look for any changes on the cervix. So that is called a VI test. So it is between again 30 to 50 years and 3 yearly, and the HPV test again between 30 to 50 years, and it can be done 5 yearly because for 5 years you can safely say that she will not develop precancerous lesions for cancer. So what is the Pap test? So basically with a small brush we take cells from the mouth of the uterus and spread it on a slide and see it under the microscope. VI, this is what we use. We just apply acetic acid on the cervix, and this is how the precancerous lesions look. So they look white. So this is acetowhite. And HPV test again, we take a little bit of cells from the cervix and then transport in a medium, and we test it for a virus. And even self-sampling is also available. So the lady can take the sample herself and send it to the lab. So self-sampling kits are also available. So as I said, this is the Cervical Cancer Elimination Day of Action. So 17th November was the day of action. So all of you, I think I request all of you, the activities that you're carrying out, the activity that you will be carrying out today, please you can email it to the WHO at this email ID. Thank you so much for this invitation and for this.
About this too. Dr. Sonal Batla is the head of Department of Gynecology and Obstetrics at the Sun Permanent Hospital. Energy District 301 has been actively associated with the hospital and with the learned doctor over a number of years. I now invite her to give her address. Dr. Sonal Batla.
Thank you very much. Dr. Manisha Kaushik and District 301 and Nisha. I am so thankful to you for giving us the opportunity to host today's event on Cervical Cancer Elimination Day of Action. I was touched by the prayer of Innerweave and the collar you all are wearing, which sensitizes all of us the message from our forerunners to work for humanity. It is in giving that you get. I extend my heart-warming thanks to Innerweave District 301 for donating the thermocoagulator and the oxygen concentrator to our department. And I assure you that we shall come up to your expectations and utilize the instruments very carefully. I shall be sharing the journey of our department's contribution towards cervical cancer prevention. Vinita ji rightly said that our department has been closely associated with this program since 2013. The second most common gynecological malignancy amongst Indian women is cervical cancer. I don't need to go into details. Dr. Sarita has kindly detailed all the things to you. These high rates suggest that women are not reaching the clinic at the right time in pre-invasive stage. They are not giving due importance to their annual screening, and or facilities to screen are not available to them. The etiopathopathology of the disease makes certain sections of population more prone to it, especially women who are into polyandry. Due to lack of national cancer screening guidelines, awareness, hygiene, literacy, and vaccination status in urban slums and remote villages, it was decided in 2017 to direct our initiative towards women belonging to this background. So, an ear to their other medical complaints and queries is the essence of the project. A team of 20 members comprising doctors, nurses, paramedical staff, and are assigned duties to carry out cervical cancer screening using via email. LBC and reflex HPV testing is conducted in suspected cases. The screen positive cases are located, informed, and formally referred to the nearby referral centers. I would like to bring to the notice of this forum one case that we detected in hilly areas of Himachal Pradesh. She was 14 weeks pregnant, a para 3, and she was having a growth on her cervix. So we did a biopsy at a remote location, brought her to Delhi, terminated her, and then this patient was subjected to hysterectomy in the village setup. And for the time she was away from her family was looked after by our team present at Himachal Pradesh. And the hospital was so kind to us that they gave us free facility for that patient to be treated at our hospital. So mammography in mobile unit for women over 40 is conducted. The Rotary is kind enough to give us this mammography van wherever we want. Vaccination against HPV for girls 11 to 14 years is arranged simultaneously to develop herd immunity so that every female member in the community is protected. For the first dose, we called them at our site to vaccinate them. We vaccinated 160 women in one of the camps. And when we went for the second time, they said we don't need it. So we had to go house to hunt for them and give them the second dose. These outreach camps are need of the hour, and it's time for the country and its caregivers to awaken to the call. Many states have adopted cervical cancer vaccination as a part of their pediatric vaccination program because of the constant pressure of scientists and NGOs. This was a camp which was conducted in Vasant Kunj area, where we conducted cervical cancer screening awareness. We had to even install a dhaba, and we invited them for chola puri so that we can sensitize them towards cervical cancer prevention and vaccination. And these are the projects that we are constantly carrying out in the schools also. We are giving the sensitizing talks in the schools about hygiene and cervical cancer prevention to young girls and teachers. So every year at Sant Parmanand Hospital, the SPH charity program, that is Inner Neer District, or the Sant Parmanand Friends Association, Department of Obstetrics and Gynecology, and Department of Pediatrics, they all collaborate to delegate. I feel pride, I take a pride to say that thousands of girls have been vaccinated on this land of Sant Parmanand. We have been very regular in giving scientific presentations also. This was a paper presented at the conference which Dr. Sarita organized. The venture noticed that active participation of healthcare volunteers and women from the area is important. The same model that we are conducting in remote villages can be adapted in districts at regular basis to extend outreach of the cervical cancer screening and reduce the burden of treatment of cervical cancer in later stages. So this is the work is being conducted on the outreach program under Okti Foundation. This is a community outreach program of the Department of Obstetrics and Permanent Hospital, which has been effectively running for past 15 years. The objective is to provide free surgical treatment in remote villages, to create cervical cancer awareness, screening and vaccination in socially and geographically deprived locations, and educate and give career guidance to the underprivileged in such locations.
Conceptualized mobile surgical camps in remote villages of India with an aim to provide specialized services sections and conduct elective surgical procedures free of cost in their local village hospitals. The team under aegis of Okti Foundation carried out its first camp in Shillai, Himachal Pradesh, and since then has accomplished more than 5,000 surgeries across 5 other states of the country. On an average, our team performs around 300 surgeries through 10 camps each year. The village hospitals have machines and other infrastructure but lack the skill. Major surgical team comprising of a general surgeon, urologist, gynecologist and an anesthetist work towards capacity building of doctors and staff at remote locations and ensure an improvement in quality of life of people by one-time surgical intervention. Let their suffering not end with the sunset of their lives. Let's step forward and reach the unreached together.
Thank you very much. I would love Innerville district to participate in our project of cervical health.
The staff, management of Sant Permanent Hospital for doing such good work. Let us give them a big hand. Coming on to the next point in our agenda of science, business, social work and arts. She embodies empowerment through her leadership roles, entrepreneurial ventures and commitment to social issues. She is a genetic engineer, gold medalist, microbiologist, a first-generation entrepreneur, a TEDx speaker, an honorary doctorate in business administration, mentor with ATL Niti Aayog, a Government of India director, SAM Solution, India Private Limited, CFO Vidyut Engineers, a certified author, an editor, a poet, a model and an actor, a social worker who has brought us fame. Dr. Manisha Kaushik is thy name. Oof. And this was an abridged version of what she actually is. Yes, friends, our guest of honor today, Dr. Manisha Kaushik, District Chairman and Deputy AC Member of Innerville District 301, is a leader who has motivated all the clubs to come forward and do this mega project commercial. I now invite Dr. Manisha Kaushik to give her address.
I hope we've started the day beautifully with such a beautiful, wonderful initiative of ours. First of all, I welcome our chief guest, our very own Association President, Sunita Jain, for agreeing to be part of this mega project, Samarpan, Rog Mukt Mahila. We at Innerville believe in mission, but no mission is complete if we don't have a vision. And that is where I must thank our association president. I must thank the health committee because the initiative has been wonderful by them. I also thank and welcome our district executives without whom I am incomplete. Our DVC, our district secretary, our DESO, our beautiful district editor who's sitting here, DCC, Seema Kedanji. We also have our International Inner Wheel past president, Abha Gupta ji. I can see a beautiful array of our PDCs, Purnima ji, Beena ji, Ruchika ji, who have taken out time to be with us. And yes, the team of doctors from Parmanand, without whom nothing is possible. Unless and until we collaborate well, we don't reach our mission. The vision will be incomplete. A big round of applause for all the Inner Wheel sisters, the presidents who at one shout came forward. And believe you me, Sunita ji, it is a matter of pride that today we have more than 43 clubs who have contributed, and I must really appreciate the initiative which has been taken by Midtown for contributing 1 lakh rupees for the cause. I also congratulate our president of Central who came forward with 1,37,000 rupees for the cause. I also congratulate each one of you, because without you, the Inner Wheel flea market or fundraiser would have been incomplete. And here we collected, the funds raised were 1,09,220 rupees. And believe you me, as promised, because this fund is ours. It is not me or you. It is all of us together, and we had done this event for the cause, and this money has gone to Parmanand Hospital from the district for this particular cause. Besides this, all of you have generously contributed, and believe you me, our PDCs, our health committee chairpersons, especially our PDC Nisha Bhargav ji and PDC Dr. Vinita Chopra, who have been working round the clock in doing this activity, and I must really thank you, because it has been very hard to close the funds which are coming, and today's mega project is over 8,21,000 rupees. So yes, I stand corrected. So we are again competing with the recent mega project we had, where we were also graced by our association president. So we're competing with that, so we are close to it. So again, like you write collectively, so it is 9 lakh rupees. I thank each one of you for contributing, coming forward. This is a wonderful initiative, and believe you me, the last time I came to Parmanand is just about a month back, not even a month back. And here I told everybody that why this is close to my heart, a cervical cancer vaccination drive, because around 10 years back, I lost a very dear friend to this deadly cancer. And believe you me, nobody knew what happened to her suddenly, and that was the day my husband took this call, that yes, it is irrespective of the age, it is irrespective of the strata of life we come from, but it is a wake-up call that it is not only the underprivileged, it is each one of us, starting at the age of 9 till the age of 55, that we must be vaccinated, because we don't know where the microbes are lurking, what is going to happen. Here I also request all the ladies present here that it is a year where Inner Wheel promotes, and especially the association president is promoting We Care. Look after yourselves. Get the mammography done. Get your cervical cancer screenings done. Get you and your staffs vaccinated and see the difference. Because if we are present, if we are alive, we can make a difference. Isn't it? And definitely each one of you are the angels who bring alive the hopes of so many more. I'm so happy to see that yes, this particular hall, the ladies are silent and listening, but there's a cervical cancer drive which is going on, and the children are super excited about it. And that is why we can hear the chit-chat. And I really feel, next time, ma'am, whenever we have something like this, we don't need any screening, We just don't need any screening, because let them hear, let them see that Today is their day. Today we are here only and only for them. So they matter to us, and that is where each and every girl, each and every human being matters. All the very best for such great projects. All the very best for coming out. A big round of applause to each one of you. And I'm sorry if I have missed anybody's name. My intentions are always very pure. So thank you so very much for coming here.
Thank you, District Chairman Manisha ji, for that very encouraging address to all of us. You are a very motivational leader and we are lucky to have you with us. Martin Luther King Jr. once said, "If I cannot do great things, I can do small things in a great way." I feel that if all inner members do their bit, it will go a long way in eradicating or at least reducing this menace of cervical cancer to a much lower level. We have amongst us Association President Dr. Mrs. Sunita Jain, who is on her official visit to our district. We are proud to hold this mega project in her presence as this subject is very close to her heart. Before I invite her, I request National Editor Mrs. Anita Jain to come and formally introduce our chief guest, Mrs. Sunita Jain.
A very warm good morning, our very dear District Chairman Manisha Kaushik ji, Chief Guest of the day, very dynamic Association President Sunita Jain ji, District Executive Committee members, past International Interview President Abha Gupta ji, District CCC, past National Editor Seema Khaitan ji, the galaxy of District 301, our PDC's team of doctors and my dear friends. तूफान से कहना है, न रुकना है, न झुकना है. आप सबने एकदम खूब पहचाना. This is our association president, Mrs. Sunita Jain ji. She is true example of strength, grace, and compassion. She is the 49th association president of the Association of Inner Wheel India clubs in India. A very important inner wheel year, inner wheel के दूसरे शताब्दी का पहला साल. मैं आप सबके सामने सुनीता जी के बारे में क्या बताएं? We all know she is a dynamic lady and perfectionist. यहाँ तक पहुँचना is not easy task. It's lot of work and dedication, and सुनीता जी आप हम सबके लिए इंस्पिरेशन हैं. आप सबका ज़्यादा टाइम नहीं लेंगे क्योंकि आप सबका और हमारे सुनीता जी का इंट्रोडक्शन उनकी जर्नी नरवेल की खुद देखेंगे. She was born in religious and successful businessman family in Gwalior. Her journey started with humble beginnings, but she always had a big dream to help and serve others. She has a master's degree in science और आज वो एक सक्सेसफुल बिजनेस वुमेन भी हैं. She is a leading a senior secondary school in Gwalior. हमारे आने वाले फ्यूचर को शेप दे रही है. सुनीता जी की इनर व्हील जर्नी शुरू हुई इन 1995 एंड तब से आज तक सुनीता जी ने हर रोज एक डेडिकेशन के साथ काम किया. यू ट्रूली आर एन इंस्पिरेशन सुनीता जी. एज अ क्लब प्रेसिडेंट इन 2010 she focused on supporting the underprivileged, physically handicapped and cancer patients. She also won multiple awards like Best President and Maximum Membership Group. पर तब किसे पता था कि ये सिर्फ एक शुरुआत थी. As district chairman in 2017-18, she started initiative like एक नई पहल जिसमें सारे क्लब्स हर महीने की 10 तारीख को साथ में आकर काम करते थे. वो भी एक सिंगल कॉज पे. हर लीडरशिप डिड नॉट स्टॉप हियर. 301 नए मेंबर, 5 नए क्लब्स. and a very impactful solar lamp project जिसकी वजह से इतने सारे remote areas में electricity आई बनती है। जहाँ भी अंधेरा था वहाँ सुनीता जी ने उजाला पहुँचाया with her work. Sunita ji has also represented in India at global inner-wheel platforms like the IW rally in Istanbul and Manchester Convention. Sunita ji's philosophy is simple yet powerful. अगर ना उठ सको तो दौड़ो, अगर ना दौड़ सको तो चलो, अगर ना चल सको तो रात को भी ना रुको, बस रुकना नहीं है। Her journey is a perfect example of compassion and leadership. She believes in the power of service. She also truly believes in कदम कदम बढ़ाए जा, खुशी के गीत गाए जा, ये जिंदगी है कौम की, कौम पर लुटाए जा। Really, it's an honor and privilege to have you with us, Sunita ji. Thank you so much for blessing our district with your presence. Really looking forward to these days with you. Thank you so much.
Ladies, please put your hands together for our teachers.
A very good morning, one and all. And this good morning, it should resonate the entire Permanent Hospital, I believe. They should know what is happening here.
Good morning.
District Chairman Manisha, the entire galaxy of Innerville 301, doctors of Permanent Hospital, everyone who has contributed in cash, kind, or in presence, or by giving time, or by giving thought. I wish to acknowledge each and every individual connected to this. And really, you know what Param Anand, that Paramanand today. Amazing. It is, I will take immense pleasure and pride in expressing my appreciation. And this appreciation is for one and all. Again, I would repeat, not only for the district chairman, because I very well understand a leader alone is only L-E-A-D-E-R. But we can only sit with that title and feel pride in our own self, and my pride and the leader's pride will not go far and wide. A leader is a leader if the leader has followers who are there every moment, every minute to give us this type of Param Anand. And it's really a great moment of pride for all of us. I believe you all will take great pride because it is a project which has been executed to this magnanimity. But for me, all the minutes what I was listening, hearing, understanding, it was so satisfying, and I was just thanking God that God has blessed me by giving wonderful district chairman as my babies, my girls, and blessing my girls with such wonderful team of members of Innerville in every club who are contributing to this extent that one single project, one single day is 10 lakhs almost. It is a very big thing, you know. When it has become 9 lakhs or 10 lakhs, it is very easy to announce 9 lakhs ki magnanimity या 10 lakhs का project हमने कर दिया. But the hard work, the hard thoughts, and the heartbeats what must have gone into this collecting this 9 lakhs of rupees, which has been shelled out by the most important fabric of the society. And women, they are the most important fabric of the society, which make more than half of the population today.
So we understand our importance, you all understand the importance of your organization. I will not take much time. We would like to see what is going on there. I would like to see what we have donated. We'll speak more tomorrow. I will only appreciate everybody. I will thank each and every person, each and every member who has contributed every single minute in understanding the importance of the Health and Hygiene Committee, all those who have put in their heart and soul in giving me this very important day in the, I should say, journey of my official visits for the district conference. It is not only the district conference or the inaugural sessions or what business sessions we'll have tomorrow. Projects of this type before that adds to the grace of such conferences. And thank you so much for giving me this. I end with just 3 words. Appreciation, appreciation and appreciation from my side for one and all. Thank you for inviting me. Thank you for all the introduction. And I wish that I will see you all tomorrow. And we will have a much wonderful time there, and wishing you that this from 9 lakhs goes to 90 lakhs in the remaining months. And I believe in this.
It takes all of us together. Thank you so much. Our district chairman, Dr. Manisha Kaushik, would like to acknowledge all the people responsible for the success of Project Samarpan. But before that, she would like to apprise all of us of a very important and newest project launched by our association president called Orange the World campaign. The topic to stop violence against women. We are all here to create awareness and work together to eliminate this menace. Dr. Manisha Kaushik.
What better a day to have all of us here. So this initiative I dedicate from District 301 to our association president Sunita ji, because her presence will make all the difference, and what a better day. We did a beautiful mega project. You all have been appreciated so well, and iske baad what are we doing? We are raising a cause, a very big cause of violence against women. Can we stand for each other? Can we or can we not?
Yes.
जब तक हम एक दूसरे के लिए खड़े नहीं होंगे तो क्या हम वो चेंज ला सकते हैं सोसाइटी में जो हम देखना चाहते हैं एज अ वुमन? बिल्कुल भी नहीं. So it is we who make the difference, very rightly said. And here I would definitely request our speaker to come forward and speak for 10 minutes. Nisha ji, please take over. So I yes, Swati. This initiative has also been taken care of and greatly helped by our beautiful club of achievers. So they have been working with me round the clock that we must create this beautifully and give Sunita ji, District 301, India, also a name on the international page that yes, this is the beginning, we are doing something on this. Sunita ji, you would like to just come around and have a look at what we created last night. And this is done late last night, so big round of applause for achievers. I would request Swati, please come forward, the club president. Please.
Ram ji. Respected District Chairman Dr. Manisha Kaushik ji, Association President Mrs. Sunita Jain ji, National Editor Anita Jain ji, and dignitaries on the dais and off the dais. नारी तुम केवल श्रद्धा हो, कहने सुनने में अच्छा है, पर उत्तर गहराई में जाकर शोषण भी उसका कितना है.
उस युग की द्रौपदी से इस युग की निर्भया ने शोषण का भार संभाला है। हाथों बातों और तानों से नारी ने कितनों को पाला है। बेटी हो या बहू हो या कोई अफसर, हर बात में टोका जाता है। कुछ भी कर ले नारी फिर भी कम है, सबने यही समझा है। पर अब बस ये सब हमें बदलना होगा। शक्ति है वो, उस शक्ति को अब अपनी ताकत बनना होगा। पीड़ा के इस भंवर से अब खुद को उसको भरना होगा। नारी का साथ रे नारी, हम सबको साथ चलना होगा। नारी सिर्फ श्रद्धा ही नहीं, उसे हिम्मत से भी बनना होगा। Every year between 25th November and 10th December, the actions against violence against women are held worldwide as a part of UN campaign Orange the World. Our heart beats for humanity. This year, Innerview members around the globe unite to stop violence against women and girls for the Orange the World campaign. As the International Innerview President Pankaj has rightly said, that by raising awareness, you can be a part of the solution. Together, let us continue to advocate for a world where every woman can live free from fear and violence. Now I request our District Chairman Dr. Manisha Kaushik to come forward and spread the message of Orange the World campaign. This campaign should not stop. This is the first day. But yes, believe you me, I believe all of you here can promise and pledge that we will work for violence against our own breed. So this is the beginning. Orange is a color nobody will know. All of us in orange, because this goes to the international bridge. This color is the symbol of the whole campaign, Orange the World campaign. And this is the graphic which was given to us by the international attachment. And this is where Innerview does not sleep. We work round the clock with the GPS. Yes, that is what we are being taught. अगर आपको लगता है तो हम आगे आ जाए
Put your names are on the public.
Yeah, she's yeah.
आरती मैम स्क्रीन बंद करवा दो। हाँ जी, एक बार देखेंगे मैम सामने, निशा मैम सामने देखेंगे।
पट्टा डालो
हाँ जी, एक बार देखेंगे सामने जी, सामने देखेंगे सारे एक बार, वो हाथ में ले लो। हाँ जी, मैं ड्रॉइंग शो ले लेती हूँ वीडियो में, उसके अंदर सारे डन।
बट आज के बाद 10 दिन बैक ऑन चलेगा। यू कैन अंडरस्टैंड स्पीक टू मी कि क्या क्या हम कर सकते हैं, राइट? आई विल शेयर दैट विद यू क्या क्या होगा।
Thank you, Swati. Good morning and Ram Ram, respected District Chairman Dr. Manisha Kaushik, Association President Mrs. Sunita Jain, National Editor Anita Jain, आप लोग का and all the dignitaries on the dais and off the dais, आप लोगों का बहुत बहुत स्वागत है। और आशा करती हूँ ये जो दिल से उठी भावना है, ऑरेंज इज वेरी वाइब्रेंट, जितना वाइब्रेंट ये ऑरेंज कलर है ना, उतनी ही वाइब्रेंट, उतनी ही एनर्जी हमारी इस लड़ाई में होगी। In a very humble tone, but with a pride, I want to introduce our first speaker, Anika Bhargava. She is a student of 11th standard. आप जब उनकी काबिलियत, उनकी बातें सुनोगे तो आपको जैसे लगेगा कि नहीं नहीं ऐसा नहीं हो सकता है, लेकिन वाकई हकीकत है ये भी बहुत छोटा हमारा बच्चा है, 11th स्टैंडर्ड में ही है, ऑफ जय श्री परिवार इंटरनेशनल स्कूल ऑफ जयपुर। आपने इनकी खूबियों के बारे में, इनकी काबिलियत के बारे में तो हमारी जो इनकी प्राउड दादी हमारी पीटी सिग्नेचर भार्गवा जी से सुनी लिया। हाथ कंधे को आरती क्या, पढ़े लिखे को फारसी क्या, क्यों ना इनकी बातें इन्हीं से सुनी जाए और फिर आप खुद ही समझिए। आइए बेटा।
So much for the lovely introduction. It's an honor to be here. Today, I stand before you not just as a young advocate, but as someone deeply committed to the idea that every woman and girl deserves to live with dignity, respect, and safety. Through my work with NGOs in the Delhi government's Women and Child Department, I've come to see the reality of violence against women in India. It's not just a series of isolated events, it's a systematic problem deeply rooted in our culture, our laws, and unfortunately, our silence. At a wedding, I asked about Kanyadan, the act of giving away the bride. I questioned aloud, why is the bride treated like property? Something to be handed over. My voice was met with awkward smiles and dismissive chuckles. You see, this isn't about festivals or ceremonies. It's about the message certain practices executed blindly suggest that women are somehow lesser, that their role is to serve, to obey, and to ultimately endure. And this is exactly where it starts. Violence against women does not begin with a slap or a crime. It begins with the small ways that we normalize inequality every single day. These traditions may seem harmless, but they create the foundation for a society where women are undervalued and disrespected. Now let's talk about what this foundation actually leads to then. 1 in 3 women experience domestic violence during their lifetime. Every 16 minutes, a woman in India is raped. Less than 30% of these crimes are actually reported because women are so scared to come out and report them. These aren't just really numbers then, they're lives, they're mothers, they're daughters, sisters, and friends. Violence against women is more than a personal tragedy, it's a public health crisis. It's a societal failure and a reflection of deeply ingrained misogyny. Now, while India does have laws aimed at protecting women, such as namely the Protection of Women from Domestic Violence Act, which was established in 2005, or the Criminal Law Amendment Act, which was established in 2013, especially after the Nirbhaya case in 2012, it introduced stricter penalties for rape. And lastly, the POCSO Act, which was established in 2012, which protected minors from sexual violence. The harsh truth is that though these laws exist on paper, they mean nothing, absolutely nothing, without action. Conviction rates in India are less than 39%. Survivors wait for years as cases crawl through courts in India. Don't get me wrong, I identify as a proud Indian, a true patriot, but I don't deny facts. The fact being that our system promises justice but often delivers betrayal. This is why I've started a petition, specifically focused on the punishment for rape in India. I'm advocating for 2 urgent legal reforms. Firstly, mandatory capital punishment for rapists in the most heinous rape cases. And secondly, fast-track courts to ensure that justice is not delayed. Now, some may ask, will harsher punishments really work? Evidence suggests that when punishment is swift and certain, it acts as a powerful deterrent. But it's not just about harsher punishments or laws then, it's about ensuring that justice is accessible, fair and timely. By signing this petition, you're not just supporting an idea, you're helping creating a movement that demands accountability from our very own leaders. What we also need to recap is that ending violence requires more than laws. It requires all of us here. It starts from speaking up. When you see a sexist comment, call it out. When you see a tradition that undermines women, question it. Instead of forwarding good morning messages tomorrow morning, support survivors by rather circulating helpline numbers. Note them down. 181, which is the National Women's Helpline, and 1098, which is the Child Helpline. It's not like people are absolutely oblivious of these helplines, but all of us often have to be reminded that they're not alone, that we are not alone, and that there are helplines that we can all turn to. Share these numbers in your communities. You can also educate the next generation that most of you here today are in fact raising. Teach children about respect, consent, and equality. And lastly, you can join me by signing this petition. The QR code is displayed on the screen above. Every signature strengthens your call for justice and ensures that this issue remains at the forefront of political agendas. Take your phones out, scan this code through either your cameras all the scanners directly and sign this petition. This is a safe, internationally acclaimed platform where your identity and your choice to sign this petition is safe and respected. I believe, and I think so do all of us, that change doesn't come from governments alone. It comes from people like you and I refusing to accept injustice as the norm. It starts with a question, a conversation, and maybe a signature. So thank you, and if you have any questions pertinent to the petition, you can feel free to ask, and I'll give all of you around 2 to 5 minutes to sign the petition. Thank you so much.
Love
Very nice. I've told the Dadi what I want.
Thank you, Anika. I request हमारे जो डिग्नेटरीज यहाँ बैठे हैं, आपका जो ऑरेंज ग्रुप है उसमें अगर आप ये QR कोड शेयर करेंगे तो उसमें और इसको पावर मिलेगा। थैंक यू सो मच। कहते हैं बेटियां माँ की परछाई होती है। God bless you. I request District Chairman Dr. Manisha ji, Association President Sunita Jain ji, and our President Swati Singh to honor Anika, please.
God bless Anika.
Thank you. Speaker Nidhi Dwivedi. She is a graduate in Environmental Science, Master in Social Work, now pursuing Diploma in Yoga and Naturopathy. She has so many feathers in her crown. अगर मैं सब पढ़ूंगी तो बहुत लंबी लाइन है, पर थोड़ा सा बता देती हूँ. Ex-member of Family Welfare Committee constituted by Supreme Court. Ex-member of Child Welfare Committee, ex-member of Delhi Commission for Protection of Child Rights. Right now she is working कि हम अपनी जिंदगी को कैसे और बेहतर बना सकते हैं. Also, she worked for 7 years at Child Home in Samanpur, Bali. She will educate us about the protection of a child against the violence. Women की तो हम बात कर चुके हैं, अब हम बात करते हैं बच्चों की, क्योंकि वो एक वुमन की बहुत बड़ी जिम्मेदारी है. So I invite Nidhi, please.
5 मिनट मिले हैं या 5 या 10 मिनट, और ये सब्जेक्ट ऐसा है कि इस पे जितना बोलो उतना ही कम है. लेकिन जैसे कि आज हम लोगों की थीम है ऑरेंज द बर्ड, तो क्या आप लोगों में से किसी ने सोचा है कि किस तरह से इस थीम को कंप्लीट करेंगे? ऑरेंज द बर्ड कोई बता सकता है? अनिका ने बहुत अच्छे फैक्ट बताए और बिल्कुल सही है. हर एक सेकंड में 14 रेप होते हैं बच्चों के बड़ों की मिला के 14 रेप हर सेकंड हो रहे हैं. लेकिन इनको हम बताया, अनिका ने लॉज बने हैं, पॉक्सो एक्ट है, जेजे एक्ट है, लेकिन इसको हम सबकी कहाँ जिम्मेदारी बनती है कि हम लोग इस पे काम करें. और हम लोग ही एक कड़ी है, हर एक मेंबर एक कड़ी है जो इस सेक्सुअल वायलेंस को रोक सकता है, चेक लगा सकता है. कि आप में से कोई बताएगा किस तरह से हम इस वर्ड को अरेंज करें, जो हम लोग की थीम.
हम सारे ग्रुप्स में डालें, सारे फ्रेंड्स को बताएं, सारे सोशल ग्रुप्स में डालें, अवेयरनेस करें.
Yes, all these factors are right, बट सबसे मोस्ट इम्पोर्टेंट फैक्टर ये है कि हमें अपनी हर एक व्यक्ति को अपनी रिस्पॉन्सिबिलिटी समझे. जिस सेक्टर में मैं रही हूँ, दिल्ली कमीशन फॉर प्रोटेक्शन ऑफ चाइल्ड राइट्स में मैं एज ए मेंबर काम की हूँ. चाइल्ड वेलफेयर कमेटी में बच्चों की जो आप डॉक्टर्स वगैरह को पता होगा, CNCP बच्चे, चाइल्ड इन नीड केयर एंड प्रोटेक्शन, तो CWC में बच्चे आते हैं. फिर आपके पास भी आते होंगे, पॉक्सो के केसेस आते होंगे, फिजिकल वायलेंस के केसेस आते होंगे. लेकिन मैंने जो फील किया है, जो प्रैक्टिकल बात मैं करूँगी, अनिका ने बहुत अच्छी फैक्ट पे बात बताई, बट प्रैक्टिकल बात ये है कि हर व्यक्ति जो जिस पोस्ट पे है वो अपनी जिम्मेदारी नहीं समझता, और वो जैसे खो करते हैं उस तरह से वो दूसरे के पाले में बॉल फेंकता है. लेकिन अगर हम में से हर व्यक्ति ये सोचे कि ये अगर मेरा बच्चा होता तो मैं किस तरह से एक्शन करती, अगर वो फीलिंग आएगी तो शायद हम लोग
बाकी में ऑरेंज द वर्ल्ड थीम को सही कर पाएंगे। तो मेरी आपसे यही रिक्वेस्ट है कि जो भी हम लोगों की पोस्ट है, हो सकता है वो पीएम हो सकता है वो डॉक्टर हो सकता है वो आईएएस ऑफिसर है, बट कहीं ना कहीं हम अपनी जिम्मेदारी से अपनी ड्यूटी को अपनी नौकरी को बचाने के चक्कर में कभी कभी हम उनसे उन चीज़ों से दूर हो जाते हैं, और तो उस समय ये वाला भाव नहीं आ पाता कि ये बच्चा मेरा होता तो मैं आज क्या एक्शन लेती। एक मदर के अगर खुद के बच्चे के साथ अगर कुछ भी होता है ऐसा, तो वो मदर किस तरह से एग्रेसिव होती है और क्या क्या करने को तैयार हो जाती है, लेकिन जब एक बच्चा दूसरे का हम लोगों के सामने आता है तो हम लोग उस तरह से एक्शन नहीं ले पाते। CWC में जब हम लोग की ट्रेनिंग होती है तो हम लोग को फर्स्ट यही सिखाया जाता है कि ये आपका बच्चा है, आप उसके गार्जियन हो, अब आप डिसीजन लो। तो मैं आपसे यही रिक्वेस्ट करूंगी, जहाँ पे भी यहाँ पॉक्सो के केसेस आप लोगों के पास आते हैं, जैसे ही कभी कभी अनवेड मदर का केस आता है और उनकी मदर्स बोलती हैं कि आप अबॉर्शन कर दो, लेकिन हमें इन्फॉर्म नहीं करना, पुलिस को नहीं बताना, लेकिन मैंडेटरी रिपोर्टिंग है एज पर पॉक्सो एक्ट, आप लोगों को इन्फॉर्म करना ही पड़ेगा, अदरवाइज आप लोग एक्यूज हो जाएंगे। तो प्लीज जब भी आपके सामने कैसा भी केस आए, आपको CWC या चाइल्ड वेलफेयर कमेटी या पुलिस किसी को भी अपनी रिस्पॉन्सिबिलिटी होल्ड करते हुए उसको इन्फॉर्म जरूर करना है। मैंडेटरी रिपोर्टिंग है, अदरवाइज 6 महीने की सजा और फाइन भी है। तो कभी कभी ऐसा नहीं कि हमें पता नहीं होता, कभी कभी हमें पता होता है लेकिन हम इग्नोर मार देते हैं, तो वो नहीं हो। टीचर्स हैं, टीचर्स के पास भी बहुत सारे केसेस आते हैं, रेस्टिकेट भी हुए हैं टीचर्स इसी में कि वो मैंडेटरी रिपोर्टिंग नहीं करते हैं। गुड टच बैड टच तो मैं नहीं बताना चाहूंगी क्योंकि वो बच्चों का सब्जेक्ट है, लेकिन मैं ये जरूर कहना चाहूंगी कि सोशल वर्क हमेशा अपने आप से शुरू होता है। अगर आपके यहाँ मेड्स हैं, आपके हॉस्पिटल्स में या आपके आसपास जो भी लोग हैं जो इससे अनअवेयर हैं, उनको आप बताओ कि आप अपने बच्चे की ग्रूमिंग कैसे करें। आपको पता है, लेकिन अगर आप उसको आगे तक नहीं पहुंचाएंगे तो वो ऑरेंज द वर्ल्ड थीम कंप्लीट नहीं हो सकती। तो आप लोगों को जो भी आपने यहाँ से नॉलेज ली है या जो भी आपको नॉलेज है एक्ट से रिलेटेड या कुछ भी कुछ सेंसिटाइजेशन, तो आप उसको आगे तक पहुंचाइए। ये हमारा प्राइम मोटिव होना चाहिए, अदरवाइज हम कहीं ना कहीं सोशल वर्क कहते हैं लेकिन करते नहीं हैं। तो पॉक्सो एक्ट में एक मैंडेटरी रिपोर्टिंग मैंने बताया वो जरूरी है। बच्चों की जो भी बच्चे आपके सामने आते हैं या बच्चों से आप रूबरू होते हैं तो उनको जरूर बताएं कि कौन सा गुड टच है, कौन सा बैड टच है। किस तरह से हम समझेंगे कि गुड टच है? 100 में से 95% केसेस में घर का ही या आस पड़ोस का ही कोई व्यक्ति होता है जब बच्चों के साथ ऐसे सेक्सुअल ऑफेंसेस होते हैं। और पहले वो जो मैंने केसेस देखे हैं उनसे मैं बता पा रही हूँ कि जब एक्यूज ना किसी बच्चे को अपने कंट्रोल में लेता है तो डायरेक्ट नहीं लेता है, पहले वो इल्योर करता है। उसको पता है साल भर तक वो लोग उसके लिए एक्सरसाइज करते हैं, साल 2 साल भी, उसके बाद वो इस तरह से मतलब आगे बढ़ते हैं। एक केस स्टडी में शेयर करना चाहूँगी आपके साथ। एक जिम्नास्टिक का कोई सेंटर था, उसमें सारे बच्चे जाते थे। उसमें एक बच्चा था 5 साल का, उसका जो टीचर था वो बच्चों को जिम्नास्टिक में सारे कपड़े करवा के उसके बाद उनको कुछ एक्सरसाइज कराता था और कहता था कि ये मतलब उसके लिए जिम्नास्टिक में आगे बढ़ने के लिए बहुत अच्छा है। और इस तरह से सारे बच्चे उसको एंजॉय करने लगे कुछ दिन बाद, 6-7 महीने 8 महीने। उसके बाद वो हर बच्चे के साथ सेक्सुअल असॉल्ट करता था और बच्चे इन्फॉर्म नहीं करते थे। क्यों? क्योंकि बच्चों को लगता था कि अगर उसने उस तरह से ग्रूमिंग कर रखी थी कि ये आपकी एक्सरसाइज है, अगर ये आपके इसका पार्ट है, आप इसको गलत नहीं समझना। इस तरह से उसने सेंसिटाइज करा। 1 साल तक उसने ये सब प्रक्रिया की। उसके बाद वो सारे बच्चों के साथ सेक्सुअल असॉल्ट कर रहा था, एक करके। छोटे बच्चे थे, 5 साल के, 7 साल के, वो डर के कारण कह नहीं पाए। और शायद आप लोग जानते होंगे, मैं तो बहुत आप लोगों के सामने एक्सपीरियंस में कम हूँ, उतना नहीं है, बट आप लोग जानते होंगे जब किसी भी बच्चे के साथ ऐसा कुछ भी सेक्सुअल ऑफेंस होता है, इवन हम कितनी लेडीज बैठे हुए हैं, लेकिन मुझे लगता है कहीं ना कहीं हमने भी वो चीजें फील की हैं। कुछ नहीं तो आंखों से, कुछ नहीं तो बैड टच, कुछ ना कुछ हम सब में से किसी ने फील किया है। लेकिन हम लोग का जमाना और था, तब हम लोग बोलते थे, लगता था सोसाइटी में अगर ये मैसेज किया जाएगा कि हम लोग ही गलत है। लेकिन आज वो जमाना नहीं है। बच्चों को ये पता होना चाहिए कौन सा गुड टच है, बैड टच है। पेरेंट्स बच्चों को टाइम दें। मैं सिर्फ प्रैक्टिकल बातें बता रही हूँ, आप लोग भी आगे जरूर शेयर करिएगा, क्योंकि हम वर्किंग वुमेन हैं, हम लोग टाइम नहीं दे पाते अपने बच्चों को। बहुत केसेस में मैंने देखा है बच्चों की ग्रूमिंग सही नहीं होती, बच्चे बहुत सारी गलत चीज़ों में इन चीज़ों को एंजॉय करने लगते हैं और ये लॉन्ग लास्टिंग होता है क्योंकि वो सोसाइटी तक चले जाते हैं, सुसाइडल टेंडेंसी क्रिएट हो जाती है उनके अंदर, और अगर उनकी मैरिज आप कर भी दो तो उनकी मैरिज कभी सक्सेस नहीं होती, क्योंकि उनको वो जो अंदर जो ट्रॉमा है वो लाइफ लॉन्ग ट्रॉमा होता है। तो यदि आपके सामने बच्चा कोई रिवील करता है कि मेरे साथ ऐसा कुछ ऑफेंस हुआ है, ये कुछ भी बात शेयर करता है, आपकी प्राइम ड्यूटी है कि आप उस बच्चे को अंडरस्टैंड करें, उसकी डीपली उस बात को समझें और उसको पहले चाइल्ड फ्रेंडली मैनर में उसको अपने फ्रेंड के तरीके से उसकी सारी बात समझें, और हर बात को किसी से कॉन्फिडेंशियलिटी मेंटेन करते हुए, क्योंकि एक्ट में कॉन्फिडेंशियलिटी भी एक क्लॉज है जिसमें आपको बच्चा अगर आपसे कुछ भी कहता है तो आप हर चीज किसी के सामने नहीं कह सकते। सपोज कि एक डॉक्टर के सामने बच्चे ने कुछ रिवील किया, आप उस चीज को कॉन्फिडेंशियलिटी तो आप जहाँ पे आपको लगता है कि इसको बताना पड़ेगा वहां तो आप तो बताएंगे, लेकिन हर किसी से आप शेयर नहीं कर सकते उस बात को। तो कुछ इस तरह के एक्ट्स में क्लॉज हैं जिन्हें हमें फॉलो करना चाहिए। और नॉलेज एक चीज होती है, बहुत सारी चीज मैं भी बोलूंगी और भी सबने बोली, लेकिन अंडरस्टैंडिंग एक चीज होती है। जब आप कई जगह देखते हैं एक ही चीज को तो आपकी अंडरस्टैंडिंग डेवलप होती है, लेकिन जब हम उस चीज को अप्लाई करते हैं जीवन में तो वो सक्सेस होता है। तो मैं आज बहुत शॉर्ट टाइम है इसलिए मैं बहुत ज्यादा फैक्ट में या उसमें नहीं, मैं आपसे यही कहना चाहूंगी कि प्लीज ऑरेंज द वर्ल्ड का मान सम्मान तभी होगा जब आप अपने से अंदर से उन चीजों को इनिशिएट करेंगे और एक व्यक्ति कम से कम 5-7 लोगों तक इस नॉलेज को पहुंचाएगा। थैंक यू।
थैंक यू निधि। थैंक यू निधि बहन। बहन इसलिए क्योंकि बहन शब्द में एक बहुत आत्मीयता है, जहाँ बात हो दर्द की वहाँ आत्मीयता का होना, कॉन्फिडेंस का भाव होना बहुत जरूरी है। थैंक यू सो मच आपने जो जानकारी दी। आई रिक्वेस्ट डिस्ट्रिक्ट चेयरमैन मनीषा जी एंड AP एसोसिएशन प्रेसिडेंट स्मिता जैन जी एंड प्रेसिडेंट स्वाति सिंह टू ऑनर हर प्लीज। जैसा कि हमारी जो डिस्ट्रिक्ट चेयरमैन मनीषा जी उन्होंने आपको बताया कि सारी रात बैठ के मेहनत करी, सारी रात बैठ के मेहनत करी तो क्या करा ये बताएंगे स्वाति सेठ।
कहना बहुत आसान है कि आवाज उठाओ, पर कहाँ सुनवाई होगी ये तो बताओ। जी हाँ, हमारी कोशिश है कि आपको अपने इन सवालों का जवाब मिले, और इसी कोशिश का नतीजा है ये ऑरेंज कार्ड which we have made with the help of our second speaker Nidhi ji. We have made this card, there are online numbers, helpline numbers on that card, जो हम आज आप सबके साथ शेयर करेंगे। एंड आगे भी ऑरेंज पे जब तक हमारा चल रहा है, हम जहाँ कहीं भी वर्कशॉप करेंगे, वी विल बी शेयरिंग ऑल these orange cards with all of the because maybe हम स्कूल में वर्कशॉप करें with the students, with the college students and all, तो उन सब के साथ हम ये ऑरेंज कार्ड शेयर करेंगे। Designed this game for some other purpose, but when this campaign came in and I looked at what I designed, God has His own ways of making people do, and here I realized something which I had designed for senior citizens, something I had designed for the ladies, came in so handy that last night we worked on it and we said, why not get this released through our very own dynamic leader who says, don't stop, go on. And I would invite Sunita ji to please launch the game. Yes. So the game is empathy.
होना चाहिए हमारे
Swati, you took us. Is she there? Okay. Okay.
So this is from recyclable material paper. Everything is recyclable. There is nothing which, this is the board. The board. So as I'm saying,
It's like monopoly.
so the
Beta.
Yes. And these are the cards they need to play. These are the cards which write about compassion, empathy. So all the girls today, 101 such games are going to be distributed. In fact, Sunitaji, we wanted to do it in a school with your kind presence, but the schools are closed because of the smog and the pollution.
Yeah, I heard that last week.
And that is where we actually changed this plan last minute, that no way, let us do it 101, तो करना ही है. कहाँ करें? जहाँ करें, जहाँ पे
Very
सब
nice,
आएंगे.
very nice. This has been very nicely made, you know, everybody should see.
Thank you
And the
so much.
cards.
Thank you so much.
मनीषा जी, मैं 7th को जनकपुरी में सेकेंड डोज जो सर्वाइकल कैंसर का बच्चों को जो दे रहे हैं, उसके लिए आई वांट टू गिव दिस टू ऑल चिल्ड्रन.
देखो आई सेड 9 से 90 होने में टाइम नहीं लगेगा.
For coming forward.
I'll talk to you.
Yeah, I did not share it because we wanted it to be launched at the hand of Sunita ji. That is why बहुत अपने आप को रोका कि President's Group I share so much with you कि मैंने उस पर नहीं डाला. So this is it to come forward.
Are most prone to be getting cervical cancer. So we are associated in a week with the Kat Katha. That rescues women from GB Road. So I just asked that lady, who's in charge of this NGO, whether the Didis at GB Road were vaccinated. She says no.
Yeah.
Okay. So this is something we can take up.
Yes, we would like to participate in that program. We actually volunteer to examine them here in our OPD free of cost.
Wow. As of now, we have done 651 plus doses as of now. Our health committee people also, because again, like I said, if me and Swati were working round the clock, yes, we also had our health committee chairpersons working round the clock and in fact making sure that I have regular Zoom meetings with them to finalize today's program. And thank you so very much. Not taking names here, I think we can start with honoring our dear doctors who have taken up so much of time, who have given us today, who have educated not only us who are sitting here, but like you said, each one can educate minimum of 5, maybe more. So you've educated families per se. Thank you so very much. I would request our doctors to come forward to please a small token of appreciation from our end. नाम आप बोलते जाओ ना.
First one is Dr. Sanita Shamsundar, our keynote speaker. Dr. Sonal Batra. Next, I invite Dr. Azul Agarwal if he's here. Dr. Shalu Jain if she's here. Dr. Payal Agarwal. Dr. Anju Bala. Dr. Arpinder Jain. And Dr.
We are going to make a member of NRV.
Oh, yes.
Different by the association, so then she has to be in NRV.
Dr. Sonal Batra is already our member, honorary member.
Yeah, I wanted one loyal club of lawyers and one club of
Doctor Club from
doctors.
Permanent is what Sunita ji is requesting, and it will be so wonderful that as me being the district
It
chairman,
will be an honor to have a club of all doctors from Doctors of Hospital.
I'm already a member of
Because that will be a matter of Paramanand for all District 301. Please do that.
Now the chairman would like to acknowledge some other people. Dr. PDC, Mrs. Geeta Goyal is not here. We will send it to her. PDC Nisha Bhargav.
Anji, please. Thank you.
National editor and subcommittee chairman, PDC Anita Jain. Mrs. Usha Jain, subcommittee co-chairperson.
Can we have Dr. Sunita Chopra ji?
Dr. Nita Chopra.
Now, past President Mrs. Usha Jain, subcommittee co-chairperson. Past President Dr. Poonam Grover. Past President Mrs. Sumita Das. Past President Mrs. Aruna Sahai.
Without to come forward for again maximum contribution for today's event. Besides this, each one of you who has contributed gets a certificate. Kindly collect your certificate from our health committee co-chairpersons.
आबादी आप कैसे मारेंगे?
आबादी आ जाइए।
आवाज प्लीज।
नहीं बचा के नहीं बचा के रखा है नहीं मेरे को सारी फोटोज इससे मंगा नहीं ले सकते।
Active member of Anti-Drug Abuse and AIDS Committee, Health and Hygiene, District Committee. He is the chairperson of Innovative I would also like to appreciate Mrs. Manisha Kaushik, and there's only one sentence we have been hearing her, but she is a true legend of Zindagi Na Milegi Dobara. Dr. Vinita has nicely introduced her. She needs no introduction, but only one sentence from our side.
I think we would request you all to come forward. And we are so excited that our organization president is there.
Whenever our department needs anything, we just call, even a single call.
And I think God has its own plans, because the other day I was talking to Dr. Sonal that we should go and help the people of red light area and see we have Mrs. Rojika with us.
And this I dedicate to each one of you. All of you. Now, I will just request once, because Neetaji would like to have a look at our oxygen concentrators.
मेरा बेटा, मेरी granddaughters और मेरी daughter-in-law वो भी हैं, तो please.
Sure.
इनको dedication है, family के बिना कुछ नहीं कर सकते. इधर आ जाओ.
I've always seen them supporting your mother and
ये सब तुम लोगों को हाँ ये इधर पकड़ लीजिए.
हाँ जी, देखेंगे मैम.